and then what should I do from now onwards to the rest of the year. So if you look for history, you see the importance of infectious diseases in human mortality has decreased a lot over time for a number of actions in public health, but an important gap remains. There are some accidents from time to time, either in in 1918 or in 2009, regarded, of course, very importantly, the proportions. Anyhow, we have to address the question, what do we do when it comes next? What do we do if the time to develop a vaccine, what do we do if it demands some time, and if we do have to make it every season? What do we do if antiviral agents are too expensive, they have way too many collateral effects, and if they're not so easy to pile stock? An addition that is being suggested on literature is to start using drugs we have already in the market. And they're not so expensive, and that could help to address this question by modulating innate immunity, both by improving antimicrobial power of the innate immune system, or from preventing it to harm the own host with excessive inflammation, cytokine storm, and so on. And some drugs are suggested. So my objective this year is to assess the microbicidal and host protective effects of potential immune modulators, and this should be done in vitro and in vivo. Of course, when we think about this, not thinking only of pandemics, but anything that can be treated with immune modulators. For this, in case of pneumococcal pneumonia, Covidsec Lab has already made some advance with statins, showing that they are effective in helping the immune system to kill the bugs and preventing it to kill the host. Now, over this last few months, the same results are being found for this, similar results are being found for another drug, josolin, the recombinant form of a molecule that is endogenous and present in the body, and that seems to be involved in bind as an acting buffer for extreme situations. It has been explored for cases like crush syndrome, when you have myocytes destroyed and lots of actins delivered to the plasma. So it binds it and serves as a buffer. But more interestingly, it also binds some inflammatory mediators, helping to keep inflammation localized. So if you produce it in a recombinant form as a drug, you should expect the beneficial effects that we're looking for. And by the results so far, you do see them. So another interesting thing is that it seems to work in terms of improving antimicrobial activity by stimulating the nitric oxide synthase pathway, which is important for delivering to the phagolysosome the nitric oxide that will further react with oxygen reagent species to generate further molecules to digest the microbes ingested. Relevantly enough, the typical way is the iNOS, but in this case, we might see some other way, as the lab has seen for statins. So what I have done directly on the Josfalin work was to assess time-wise the concentrations you can find of this drug when it's aerosolized and administered to mice through the technique, obviously, of bronchoalveolar lavage in the Western blot. So this slides to introduce back influenza and to show the importance of histopathology this disease can cause. Here you see this wine-colored lung showing the diffuse alveolar damage with hemorrhage that the work of the Department of Pathology in FMU-USP was the first in the world.
A remark on this study. We collected prospectively 21 cases of fatal H1N1 pandemics in 2 weeks. We did all the immunohistochemistry, the clinical charts, the bacteriological identification, and we submitted the New England Journal of Medicine. It was rejected, was published in the Blue Journal as a photograph in the what's in the front, the cover, and then New England published 6 weeks after a 5-case study with AG stained in the Mexican and the American collaboration. I wrote a letter and said, why? And he said, no, it's our attitude. But you have a letter, this letter. I answered, that's not attitude, but latitude. I think was not a fair decision on this study. I just want to express that it was but it's a massive information, isn't it? And it died because of bacterial infection, most of the cases. And it's not because of the virus. I think this is
and the comorbidity that previously existing conditions was important as well, right?
Yes.
So in this Scandinavian study, the most important feature analyzed was coronary heart disease. But what you see in this graph is the protection this investigative taking group had concerning influenza, hospitalization, and mortality. The question that remains, though, is whether this is due to some kind of lifestyle these patients might have for being chronically medicated patients that may take care of their health in some way differentiated, or this is a real effect of the drug. If it is, this is one of the proposed pathways. That is, statins by blocking the generation of cholesterol also interfere in the generation of something important to the expression of inflammatory mediators, especially cytokines and selectins, thus limiting vascular permeability and therefore inflammation. This we try to address on a study that was performed over the last month, a little bit more, that I participated. The person was Sanjukta Ghosh performed the study. So in this study, failed to show any difference for statin as a treatment after the onset of disease. That would be the expected approach safe paranormal forecasting for the treatment of human influenza. But it may show some protection for chronically taking studies that might be an explanation for the Scandinavian study. So the future direction that I have now is to keep using this methodology to assess the other immune modulators that I had mentioned earlier. And for a matter of time, but keeping still an interesting designs, to first do an assessment in vitro on these 3 classes of drugs, and then choose the one with the most promising results to bring for an approach in vivo. And this should contribute to address this threats, both for pandemics and that pose to human health. And this I'm going to skip for the time. And thank you everyone in the lab. Thank you. Obrigado, professor. Prazer a gente aqui. And